Today we are gonna do dressing change. The first thing we are gonna do is we're gonna verify our physician order, and then we are gonna gather all our supplies. I'm gonna identify my patient by their last name and the date of birth, Jan Doe 1950. Now I'm gonna do hand hygiene. I'm gonna put on some clean gloves. Now I'm gonna remove the dressing away from me first, then from the side, and I'm gonna check the drainage and put this in a biohazard bag. Now I'm gonna assess the skin around the wound. The skin is intact and there is no redness. Now I'm gonna discard these gloves, do hand hygiene, put on a clean gloves again. Now I'm gonna open my supplies. Now I'm gonna take some normal saline. I'm gonna lip it. Now I'm gonna pour it over this. Now I'm gonna clean the wound from clean side to the dirty side. I'm gonna discard it. Now away from me first. Now closer to my side. Now I'm gonna take my dry gauze and I'm gonna dry it the same way, clean to dirty. Away from me. And closer to me. Now I'm gonna take my ABD pad. Now I'm gonna take my dry gauze and put it over the wound. Now I'm gonna take my ABD pad and I'm gonna tape it. And I'm gonna take another tape with the date, time, and my initials and put it over the ABD pad. Now I'm gonna discard my gloves, do hand hygiene, and I'm gonna document whole procedure and how the patient responded. The patient tolerated the dressing change. Patient stated he had no pain, and how the skin looked around the wound. The skin was intact, and there was no erythema around the wound. Now we're going to talk about different types of dressings. The types of dressings we have are hydrogel, hydrocolloid, calcium alginate, the dry gauze, the kind that we used, some silver impregnated dressings. Some bandages we can use is the stretch bandage or the elastic one. And the drains, the type of drains are Pepros drain and the Hemovag. The Hemovag is a negatively pressurized drain, which is like continuous, and that's all. Thank you.